So just finished seeing Mr. Simpson. He's a 37-year-old Caucasian male that presented with a past medical history of hypertension, GERD, allergies, and gout. And he presented today to the clinic in an acute gout flare-up. He states the pain started last night. He took colchicine, 2 tablets, and he was awakened at about 3 a.m. with a lot of pain, swelling, and redness in his left great toe. He states that he took an Elective, couldn't go back to bed, woke up, and this morning it was more swollen and red, and he couldn't even walk. So he decided to come in today to see if there's something chronically that we could do to help it feel better. He did mention that this is his second acute gout flare-up in the last 3 months. He tried managing it 2 months ago when he came in through diet and exercise. He is aware that he must avoid red meats as well as beer and alcohol, and his uric acid levels 2 months ago were 10. So he admits that diet and exercise aren't sufficient and would like some long-term medication options. He was diagnosed with gout 2 years ago and was on allopurinol. However, he was concerned it was impacting his kidney function. So he wanted to come back today to revisit this conversation of starting this long-term medication. His kidney functions 2 months ago were within normal limits. So making sure that he is aware that we would have to just monitor those kidney functions more routinely if he were to be started on this medication. He also did admit to having a newborn boy within the last 3 weeks and fears that maybe the stress and lack of sleep could be contributing to this. Like I mentioned, exercise and diet are not fixing it for him. In terms of past medical history, he is just on the losartan for his high blood pressure and is well controlled and well managed by his PCP. For allergies, he's on Flonase and Allegra. For his GERD, he's on omeprazole, and he has had no recent surgical history or previous hospitalizations, not on any type of antibiotic, hasn't had any upper respiratory illnesses or any sick contacts, hasn't traveled, it has no medication allergies. And in terms of social history, he avoids alcohol, does not do illicit drugs, is not a smoker. He's currently a stay-at-home dad. And family history, his father does have gout as well and is on allopurinol. And then in terms of ROS, so as he mentioned, the pain started last night. So, and there is some swelling as well as redness. He doesn't mention any specific swelling on his ankle or on his knee further up the lower leg. And he denies chest pain, shortness of breath, abdominal pain, headache, syncope, nausea, vomiting, or diarrhea. On physical exam, he is alert, in no acute distress, and he appears well-groomed and well-dressed and appropriate to his age. On physical exam of his lower left leg, there is some redness, erythema, edema, and some tenderness to palpation on that left great toe. He does have full range of motion on his ankle as well as his knee, and there doesn't appear to be any redness. It's very localized, so that left great toe doesn't appear to be any cellulitis. Normal active bowel sounds. Lungs are cleared to auscultation, regular rate and rhythm, and all pulses are 2+ and bounding. And in terms of his vitals, his blood pressure is stable, 124/78. Respirations are 16, and he's afebrile. So based on all this information, because we had done uric acid levels, CBC and CMP 2 months ago, I want to go ahead and reorder these, especially because we're going to put him on allopurinol chronically, since he's had 2 in the last 3 months, and then in about a year, he says he's having about 5 or 6 episodes of gout. So we need to make sure we're putting him on this long-term medication so that he has these acute gout flare-ups less frequent. So I went ahead and ordered a CBC and a CMP just to have a baseline prior to starting allopurinol of his kidney function and also uric acid levels. we already know that he has gout, so there's no need to order a synovial fluid analysis, because it would just show us the negative bifringent crystals. And of course, on physical exam, it doesn't appear that there's any cellulitis, so we're not concerned about getting an x-ray to look for bone infection or soft tissue infection. In terms of differentials, some things to keep in mind when that could mimic gout. So we always want to rule out if there's any previous trauma to the affected joint, specifically the left great toe. We want to check for cellulitis, pseudo-gout. We also want to rule out rheumatoid arthritis, psoriatic arthritis, any soft tissue malignancy. And pretty much those are the main things that would mimic gout. Once we go ahead and start him on the medication, we do want to encourage him to be aware that colchicine and naproxen, which are usually treated for using acute flare-ups, should only be used if there's an acute flare-up. But he should, we'll go ahead and dispense those to him just so that he has them. He did mention colchicine is currently expired, but we're going to start him on the lowest dose of allopurinol, 150 milligrams, and we're going to have him come back once those results are done, the CMP and the CBC, especially if there's any abnormalities. We're going to educate him on diet and exercise, making sure that he's avoiding those high meats, anything that's high in purines, as well as alcohol, specifically beer. His blood pressure is well managed, as well as his GERD and his allergies. So just having him follow up with his PCP every 3 months to just get those labs done. And then letting the patient know that if he's starting on the medication and he notices any increase in chest pain, shortness of breath, any redness that spreads further up his leg to his ankle, limits his range of motion, that he should go ahead and proceed to the urgent care. And if he has any other questions that are not emergent, he can always call his PCP back, and they can schedule him for a revisit after he's went ahead and started that allopurinol.